Hello, Dr. James Bogash, expert in health and longevity. And 4 years ago, 3.5 years ago, I was saying that by the time everything came out with COVID, we'd find that we overreacted in a lot of scenarios, and that much of what we heard initially was not going to be true, and that while COVID had a nasty predilection for those people with pre-existing metabolic problems, it really didn't behave any differently than any other respiratory virus that we've had, and the data continues to play out with that. And this particular study has to do with immunosuppression or immunocompromised people. And holy cow, in 2020, 2021, 2020, you'd think that every other person in the planet became immunocompromised and that they were terrified hiding out in their closets because they thought their immune system couldn't tolerate COVID. Well, two sides to that story. The first is anybody who has poor metabolic health, which is arguably 90+% of the population, does have some degree of immunosuppression. The nice thing is that everybody under that category will do better with healthier lifestyle changes, diet, exercise, sunlight exposure. Not anything that we talked about or still are talking about. Blows my mind that we've completely danced around that elephant in the room. But, so yes, everybody, like most of the population, was to some degree immunocompromised, but not in the way that they thought. And those people were led to believe that, or they weren't educated that there was any difference, that they could actually do something about the condition that they're at. So again, healthier lifestyle changes, regardless of your scenario, will help with your experience with a respiratory viral infection. Now, there are people who have really are immunocompromised, people currently undergoing cancer, people who are on anti-transplant medications, people who have certain hematological cancers. Like those are things. Then we had like the TNF alpha blood, the biologics, so like Remicade, Enbrel, all of those. There's a long list of drugs that fall under the biologics now that interfere with the immune function for autoimmune diseases. There are people on steroids. There are people with B-cell deficiencies. This study looked at all of that, and they found that really the only two groups that really had a problem and took longer to clear the virus are the groups that we would expect to have problems, and that 20 years ago, these are the people that we expected to have problems, and they would legitimately be wearing masks in certain scenarios. That has always made sense for personal protection, and that is people with hematological blood cancers, and especially if they're undergoing treatment, they could take upwards of 72 days. The average time is 72 days to clear the virus. And transplant patients on anti-transplant medication, they took 40 days. Those people were also more likely to seed variations in the virus, exactly what we would have expected. People who had beta cell or B cell deficiencies, we forget that we still have T cell immunity, and those people didn't really function any different than the rest of the population as far as how long it took them to clear the virus. TNF alpha blockers, steroids, all of those things, there was no difference in how they cleared the virus or how long it took them to clear the virus or their immune response. I'm not saying that those people didn't have problems with COVID, but it had to do with underlying metabolic health and not the fact that they were immunocompromised, which people started wearing. It was like a badge of honor for a long time there. And really, we still, which is okay if somebody's immunocompromised. They're like, hey, but I'm exercising, I'm getting my sunlight, and I'm eating right. That would have been a different story, but people wore that badge of immunocompromised as being a victim. I hate to say, but that's really the reality of how of those people came off. So, as always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.